The pectoralis major is a broad, powerful muscle located on the chest. Except for the part beneath breast tissue, its convergent, superficial fibers are accessible. Pectoralis major is divided into three segments: the clavicular, sternal, and costal fibers.
So my partner supine on the table, and I'm going to begin by engaging the pectoralis major. So go ahead and make a gentle fist and just press it into your hip. There you go. And so he's adducting the shoulder joint. And there we can see a fabulous example of the pectoralis major, fully superficial on the top of the chest. Good. Go ahead and relax. So with that in mind, let's find some key bony landmarks that help isolate the pectoralis major. So first, I'll find the clavicle here, just on the top of the chest, and I'll isolate that medial portion, which leads to the top of the sternum, and I can follow all the way down the surface of the sternum to about the line of the nipple or beyond there. And that is going to be the medial outline edge of where the pectoralis major attaches. And then I can follow those convergent fibers laterally to where they tuck underneath the deltoid and attach here on the anterior surface of the humerus at the crest of the greater tubercle of the humerus. Now, this isn't going to be a bony landmark that you can readily isolate. It's a little difficult at first, but it's nice to know its general location here on the anterior surface of the humerus. Good. So now let's go ahead and engage the muscle again. Super. And so here we can see that outline of the muscle. There's the inferior edge. There's that superior edge, that deltopectoral groove that separates the pectoralis major from the anterior deltoid. And we can also even see some of those fibers converge that way. Good. Go ahead and relax. So now, with that in mind, I can reach in and really grasp a lot of this tissue that's the pectoralis major. And really lift this up off the rib cage. And it gets much thinner as you move medially toward the sternum. And as those fibers converge, it gets quite thicker here as it passes just beside the deltoid. Good. Now, if I wanted to shorten or lengthen the pec major, I can just abduct the shoulder up over the head, and all of these fibers lengthen. And then to shorten the pectoralis major, I can just bring the arm forward into flexion and adduction, and all of those fibers become very shortened. Good. Go ahead and relax. Now, that was relatively straightforward since my partner was a male. But the question arises, when palpating on a female, how do you access the pectoralis major and other muscles of the chest and axilla without contacting breast tissue? Well, let's show you how. So the first thing I'm going to do is just communicate my intentions to my partner. So Lynn, I'd like to access the pectoralis major. It's a muscle of the chest. Would that be all right with you?
Yes.
Okay. And if at any time you get uncomfortable or you want to stop, you just let me know. Mm-hmm. Okay. So my partner's in a supine position, which oftentimes the breast shifts laterally, which makes it much easier to access this sternal area in between the breasts, right here, as well as the upper pectoral region underneath the clavicle here. But oftentimes in a supine position, large breasts will shift laterally and crowd the axilla. Well, we have two options. First, I can ask my partner, Lynn, would you be willing to just shift your breast medially away from the axilla? There we go, like so. And then I can position the arm and open up the axilla and access some of this tissue right here much more easily. Pectoralis major, pectoralis minor. The other thing I can do is I can just use the back of my hand like so to shift breast tissue out of the way and again access into the axilla. So those are just two things that you can do here with your partner supine. So in a sideline position, breast tissue often falls down toward the table away from the axilla, and by just shifting the arm and scapula forward allows for much easier access of the axilla, and the breast tissue is completely out of the way.